Darzalex Faspro is a groundbreaking drug for the treatment of multiple myeloma, helping improve the quality of life for patients and their families.
Darzalex Faspro is really a marvel of modern medicine.
Having Darzalex Sub-Q was a blessing. It gives you a lift. I don't feel like I'm ill.
It gives me a lot more freedom, and also I don't feel so much like the patient.
Darzalex Faspro really offers our ability to create an optimal quality of life for patients with multiple myeloma.
Multiple myeloma is a blood cancer that affects the bone marrow. More than 160,000 Americans are currently diagnosed with this disease.
We call it a blood cancer because the cell that is cancerous begins in the bone marrow, which is the factory of our blood. It's a special cell called a plasma cell. They grow within the bone marrow, and sometimes they actually escape the bone marrow and can collect in other places, forming little, if you will, microtumors throughout the body.
Darzalex Faspro is an immunotherapy. That means it sends signals to the patient's immune system to directly kill multiple myeloma cells.
Darzalex Faspro is the subcutaneous version of the drug we have been using for many years, Darzalex, also known as daratumumab. This is a drug that targets a certain feature on the outside of a myeloma cell called CD38, and it hooks onto that CD38 and triggers the immune system to help destroy the cell. So it's a little bit like a silver bullet where it is able to go and hit the myeloma cells but preserve the other good cells.
Jim Mahoney was diagnosed with multiple myeloma in 2005.
The doctor told me it was multiple myeloma. I knew what that was. I also knew that it wasn't a curable disease. I thought my life was over.
Jim loved the busy life he led, raising 3 children with his wife Lisa, while pursuing a demanding career as an executive at a waste management company.
I was very active. I was doing very well as a national account manager. And every weekend from the fall through the spring, there were play rehearsals and all sorts of practices with the kids. We lived a very active lifestyle.
Thanks to a successful course of treatment, Jim's myeloma went into remission. But in 2019, the disease returned, and his doctors turned to Darzalex.
My first experience with Darzalex was the infusion, was the 8 hours in the chair.
Jim was relieved that Darzalex was effective at treating his myeloma, but the day-long infusions took a toll.
But it is a full-day commitment.
When Darzalex became available as a subcutaneous injection, Jim did not hesitate.
And the doctor said it's about a 5-minute injection in your stomach, and you'll be on your way. Having Darzalex Sub-Q was a blessing. It was a dream.
The subcutaneous has allowed him to maintain a more active lifestyle and do the things that he wants to do.
Patients can say that when they're not at the clinic, they can almost forget that they have multiple myeloma, and that's really what we want. We want patients to have an optimal quality of life outside of the treatment that they endure for multiple myeloma.
Darzalex Faspro is administered into the skin of a patient, typically around the belly, where it is a smaller needle that we insert, and the infusion of the drug takes around 5 minutes.
Another key benefit of Darzalex Faspro is that patients don't have to have painful intravenous infusions.
Veins sort of have their shelf life, and over time, it's a little bit more difficult to find that vein.
That was the case with Janet Kerrigan. She was relieved to have a quick sub-Q injection instead of a time-consuming infusion to treat her myeloma.
It can be painful, especially if they have to do 3, 4, 5 sticks in order to get it intravenous going. And the good thing with the Darzalex Faspro that I'm on right now, the injection itself I don't find painful. It's a quick little zap, maybe between a bee sting and a mosquito bite. They basically clean the site, inject the medication slowly, and talk to me and put a Band-Aid on, and I have to sit there for another 20 minutes. They take my blood pressure again, and then off I go.
Darzalex Faspro was Janet's fourth line of treatment. A former nurse, she was amazed at how few side effects, if any, she had.
I just had some shortness of breath, and that was it.
Another benefit of Darzalex Faspro are the minimal side effects.
One of the real benefits of Darzalex Faspro is that as we're able to give the drug subcutaneously in the skin over that short period of time, the number of infusional reactions has dramatically been reduced.
Patients ask a lot of questions about Darzalex Faspro. As Darzalex Faspro is injected into the abdomen, am I going to have complications related to that? You might have some redness at that site, but it's really very well tolerated.
It's always important for patients to talk to their care providers about any evidence of an infection, fever, cough, shortness of breath, those kinds of things. So we do see a, thankfully not very large increase, but an increase in infections. Once the body adjusts to Darzalex Faspro, it's very easy to administer and the body accepts it.
Other possible side effects include shortness of breath or trouble breathing, dizziness or lightheadedness, cough, wheezing, heart beating faster than usual, low oxygen in the blood, throat tightness, runny or stuffy nose, headache, itching, high blood pressure, nausea, vomiting, chills, fever, and chest pain.
We're going to give Darzalex Faspro weekly for at least 8 weeks. It depends upon what we're giving the Darzalex Faspro with. Then that is going to be given every other week for about a total of 24 weeks. And then with Darzalex Faspro as well as with IV Darzalex, you can go to monthly infusions if your disease is well managed.
Janet was diagnosed with myeloma in 2011.
When the doctor told me I have multiple myeloma, I just kind of turned my head from side to side and said, you must be talking to somebody else. Here I am. I'm never sick. I've never even had the flu.
Janet had lived an active life as a mother and full-time nurse. After her diagnosis, she researched the disease and focused on living life to the fullest.
I always have believed that when you're confronted with a problem, you try to figure it out, you pull up your big girl pants and you move on and you plow through it.
Thanks to the ease and convenience of taking Darzalex Faspro, Janet and her husband can now make the most of their retirement, enjoying each other's company and their family.
I tell this to my specialists all the time. I said, it's a nuisance, but if I have to take medication in order to get through the day, that's what I do.
Janet is grateful that she was a candidate for Darzalex Faspro. It is approved for people like Janet who have had one or more treatments for multiple myeloma, as well as newly diagnosed patients that cannot receive a transplant.
The indications of Darzalex are many, and indeed now with Darzalex Faspro, and we anticipate that we'll actually be able to use Darzalex Faspro whenever we would have used Darzalex IV by itself.
Not only can Darzalex Faspro provide a better quality of life for patients like Janet and Jim, but studies have shown it is just as effective when given as a sub-Q as through an IV.
Darzalex Faspro is a very effective drug. We've seen it used as a single agent by itself and in combination. And the first thing to note is that it really has paralleled the response rate and the efficacy that we've seen with the IV formulation.
Not only have studies shown Darzalex to be effective, but safe as well. Janet and Jim can't believe the difference Darzalex sub-Q has made in their lives.
Being on Darzalex is great. The side effects aren't there. You feel normal again. I know that it's the right drug for me because it's working.
It gives me a lot more freedom as far as time, and also I don't feel so much like the patient.
And as support group leaders for the International Myeloma Foundation, they are committed to sharing their knowledge and optimistic outlook about the future with others.
My goal in life is to live, of course. My hope is for a cure.